Fecal transplant is basically getting the stool of a healthy individual,
Okay.
processing it, and then delivering it to a patient. So the which can be through the mouth, through tablet, can be using a scope.
The psychological aspect of it we have to overcome first. But
Yes, the yeti part of it you can overcome. But as a patient, you probably won't know if I don't tell you.
all right, welcome back. Thanks for joining us. Today we have a very special guest, Dr. Wang Yu Tien from Nobel Gastroenterology Center at Gleneagles Hospital. He's a seasoned gastroenterologist with 20 years of experience from Singapore General Hospital, where he was a senior consultant, director of research, and faculty for senior resident training. He is a leading authority on digestive function disorders, which is his area of special interest. Join us as we explore his expertise and insights in the field. Welcome.
Thank you.
So to kick things off, could you share with us, what motivated you to actually start this journey and this focus to become a gastroenterologist and also specialize in digestive health? Yeah.
Thanks, Jay. So very simple. I enjoy my food, and I've noticed that a lot of people seem to have digestive tract problems. So
Okay.
really, my motivation of joining to become a gastroenterologist is to really help everybody to enjoy their food and to help manage their digestive symptoms.
Wow, spoken
Yeah.
like a true blue foodie Singaporean. We all enjoy our food.
So one of the areas that drew me to my particular area of interest, which is digestive function disorders, that I realized as I started training that a lot of people indeed have these tummy pain and change in bowel habits. This is actually one of the most common symptoms around. In fact, there are studies to show in Singapore around 20% of the people do complain of these kind of symptoms and see doctors for this problem as well.
Okay.
Now, what drew me directly into this was that as I went on with my training, I realized that as doctors, I think a lot of patients will realize we are very good at excluding dangerous problems. And of course, in this day and age, everybody wants to be sure they don't have cancer. We want to be sure you don't have a serious infection or an ulcer. And in my training as a gastroenterologist, we were very well trained to do this.
All the high risk issues to face.
Exactly. So many patients who see their gastroenterologist will probably have undergone a scope of their stomach and
Okay.
colon, a
Okay.
scan of their tummy or blood
Right.
tests. So we were very good at doing these things. But at the end of the day, what we realize is that a lot of the time, we don't find a serious problem. And these people continue to have the symptoms that they do. So it became very frustrating because, yes, some of them did get better with our usual medications, but a lot of them don't. And this is the group of people we call functional gastrointestinal disorders.
Okay.
Okay, there is a newer name, which is even more confusing, called disorder of brain-gut interaction.
Wow.
Okay, yeah.
Disorder
So
of
there you go.
brain gut. Okay, there's
Yeah.
a link I can see.
Exactly. Yeah. In my later part of my training, I started to realize that actually these functional disorders actually form the bulk of the patients that we see. And in fact, there are studies to show that they seem to be increasing through the years. So this is studies that we've seen that in the 1990s, about 50% of the patients who saw gastroenterologists with functional disorders. In the late 1990s, it went up to about 60+%.
Wow.
And the latest data, which was collected in SGH about 20 years ago now, shows nearly 80% of the people
That's
who
a
come
lot.
exactly have these
Yeah.
functional disorders.
Wow. So it sounds like there is actually a lot more underlying that's undiscovered or unspoken about in our
Exactly.
day-to-day. And most of the doctors or most of the traditional methods of treating is just giving medication, doing a scope, or cutting something out. And the root of the problem is actually not fully addressed.
Exactly. So, well, fortunately for us, a lot of people really just want the reassurance that it's not something serious. So the reality is that what we usually do in terms of excluding a serious problem does suffice for a lot of patients. Probably the biggest group of people that people know about will be in the realm of irritable bowel syndrome.
Okay.
Yeah, it is basically a group of patients who continue to have abdominal pain, bloating, diarrhea, constipation, despite undergoing the test that I mentioned and finding that there's no serious problem.
So IBS or irritable bowel syndrome is a very common umbrella term that people tend to either some of them I think they self-diagnose as well, right? Say, oh, I
Yeah.
probably have IBS, or I
Yeah.
probably have some kind of sensitive tummy.
Yeah.
So, but what you're saying is this is an underlying symptom of actually a deeper problem that
What I guess differentiates me from a lot of other gastroenterologists is that for these patients who need it, we can go a little bit deeper to understand what is the cause of their symptom and try and address it. After that, that's how we diagnose that this is a functional disorder or irritable bowel syndrome. This is where it gets a little more interesting. We can start looking at what is the underlying cause. Very often, we may not be able to find one specific cause because, as you pointed out, it's an umbrella term for a group of symptoms that may be caused by a group of disorders.
Okay.
And this includes things like stress, it includes things like abnormal movement of the gut, normal bacteria, be it too much or abnormal composition of the blood, as well as some malabsorption problems.
Right.
Yeah.
Wow. I love the fact that you're going beyond just basic treatments just to rule out the big problems, but you go deeper and figure out like how can we make this better. Yeah.
Yes, exactly. So one of the things that we do that a lot of patients with irritable bowel syndrome come with is that many patients have bloating. So one of the things we look at is whether they have what we call small intestinal bacterial overgrowth. This is the concept of that revolves around fermentation. So I think being a baker, you know you're a baker, right?
Yes.
Yeah, being a baker, I'm sure you're very familiar with fermentation.
Yes. Oh, yeah.
And we depend on fermentation to create some gas.
That's right.
Yes.
And that's where excessive gas comes in, and
Exactly.
that's where the bloating comes in,
Yes.
right? Okay.
So the concept of SIBO comes in that in our small intestine, if there is too much bacteria, when the carbohydrate goes through the small intestine, the fermentation is also excessive. So it produces too much gas, and this gas may be a cause of a trigger of their symptoms. For example, bloating or even diarrhea.
Okay.
So one of the tests we can do is called hydrogen breath test,
Okay.
where the patient consumes some carbohydrate, and we literally get the patient to blow into the tube, and we measure the amount of gas that's produced.
Ooh.
And this might help explain some of the symptoms that the patient get. And of course, if we do find that they have this small intestinal bacterial overgrowth, we can treat them.
It sounds like what we eat affects a lot about our gut health in general. So from your experience, right, what are some of the foods that you would actually advise to take for people in general who want to just have a better holistic, like better health in general?
So I think this is a very hot topic, and a lot of people, patients like to talk about it. I think there's a slight difference between a person's gut with healthy bacteria, which can promote good health, versus a person whose gut has no symptoms. Yeah, because just because a person has a little bit of bloating, it doesn't mean that their gut bacteria is necessarily unhealthy in the sense of, the gut bacteria composition demonstrating that it's an unhealthy composition. On the other hand, just because a person has no symptom, it doesn't mean that the underlying bacterial composition is necessarily very good. In fact, it is perhaps not very well known, but early cancers, which you imagine is a very dangerous problem, have no symptoms. So symptoms don't necessitate health necessarily. But I think back to what most people are interested in is going to be about gut microbiome. We've learned a lot about this in the last 20 years. Broadly speaking, a gut microbiome which is diversified, meaning having many different types of gut bacteria, is generally associated with health.
So it's a whole cocktail of bacteria in our gut. It actually benefits us more.
Yeah.
Okay.
Because studies have shown in older, frail patients as well as those who are unwell, the diversity of their bacteria is the one that suffers the soonest. So in line with this, the recommendation is going to be what can make more bacteria grow. So vegetables, fruits are food for bacteria.
Okay.
So following that rationale, it is sensible for us then to eat a large variety of fiber food, vegetable, fruits, and these are the things that's really going to help populate a wide, diversified population in your gut.
Okay.
The reverse, of course, is that antibiotics are not going to be good for this. We try to minimize unnecessary antibiotic use. I think when I was a child, a lot of doctors do use a lot more antibiotics than we do now.
I agree.
In this generation now, we really only use it when we need to. And I think that's a very sensible thing to do. And studies, in fact, shown the younger the person is exposed to the antibiotic, the more permanent the change to their gut bacteria.
Permanent change,
Yes.
even from a young age.
Yes.
Wow. Okay. So I have another question. The other reverse. What about things like prebiotics, probiotics, or even like kombucha? What is your take on those?
So prebiotics is food for bacteria.
Okay.
So in a way, your fiber from the fruits and vegetables are your prebiotics.
Okay.
Probiotic is the actual bacteria. So in irritable bowel syndrome, we do use probiotics. Rationale behind that is that we do know that in the patients with irritable bowel syndrome seem to have a different distribution of bacteria in their colon. So with this rationale, we believe that using some probiotic may be able to rectify this. And in fact, there are studies to show some probiotics may help this.
Okay.
Yeah.
What about for normal people that don't have any symptoms, just to take it for a better health, like a supplement, like a vitamin every day? What do you think of that?
Short answer is we don't know. The jury is out there.
Okay.
I think the rational thinking would be that it may help, but it's very hard to prove this scientifically.
Okay.
Because in order to demonstrate that the probiotic is actually helping a person, we usually in a research study will need to define a certain premise of improvement. So what is it that we're trying to define? Is it longevity, reduction in getting chronic diseases? Whereas for something like irritable bowel syndrome, we can still study it to say, oh, did this person's bloating or pain get better?
Right.
So there is a very clear endpoint to study. And that's why it's easier to study this group of probiotics. I think the rational thing I would tell my patient, if they were to take it, is that I don't think it is harmful, provided it's not causing you any problem. Going back to this point is that sometimes the prebiotics may actually cause certain symptoms like bloating. If you think about it, the prebiotic is the food for the bacteria. They do undergo fermentation, and the fermentation, as I alluded to, may cause symptoms like bloating. It may not be bad for longevity, but it may cause bloating. So this is where we have to be very careful. That's why I say symptom versus what is a healthy composition of gut is a little bit different.
Okay, so I would like to shift the conversation a little bit to people, they are not diagnosed as celiacs, but at the same time, they think that having a gluten-free diet helps in maintaining better health. Like, what is your view on that?
So I think a lot of this comes from the original diagnosis of what is a celiac disease. So in celiac disease, it is basically inflammation of the intestine caused by food that contains gluten, as you mentioned.
That's right.
And this is a very objective finding. When we do a scope on the patient, we will find that there is actual inflammation in the small intestine.
Okay.
There are also blood tests that we can do to tell us the patient has celiac disease. And the key to this type of avoidance of gluten is that it is very, very strict. We can't even have trace amount of gluten. Many patients with celiac disease also have non-specific symptoms like tummy pain, bloating, and diarrhea. Very close to what we see in irritable bowel syndrome. So a lot of the patients then with irritable bowel syndromes, which I alluded to, is a big proportion of the people, then think that perhaps avoiding this group of food may be a good idea.
Okay.
But when we delve a little bit deeper into it, it may be that they are actually avoiding food that are undergoing fermentation, is producing their symptoms. So the diet that is now recommended for irritable bowel syndrome, known as the low FODMAP diet, or in simplicity, fermentable carbohydrates. Again, we're coming back to the beautiful term fermentation. This time, the fermentation is not happening in the small intestine, what we mentioned earlier, but in the large intestine. So in this diet, the understanding is that some carbohydrates, when you consume them, if they're not absorbed in the small intestine, they should be. If they're not fully absorbed and they get into the large intestine where most of our bacteria is, then fermentation happens. And again, the excess gas may cause bloating, abdominal pain, and diarrhea. So in this diet, which is I usually recommend best done with the help of a dietitian, is that first, in the first stage, avoid every food on this list for, say, 3 weeks to determine whether or not one symptom improve. Then in the next stage, which I think is even more important, is to reintroduce in a systematic manner each of the groups. So there are 5 groups here. So on week 1, you will introduce one group, and the first group may be, for example, the fructans group, which incidentally is where the gluten is in as well. Yeah, and test whether your symptoms return.
I see.
So if you get symptoms, then you know, this group 1 is likely to cause your symptoms. And then you test group 2, group 3, 4, and 5, and so on. So, and in the end of the process, you probably identify 2 to 3 of these groups that are the trigger your symptoms. Our caution is always be careful about overdoing it. And I think the other point that has been brought up a few times is that this diet is not meant to confer health. So I'm not asking everybody to go out there and take this diet to have a healthy life.
Right.
This is a specific diet designed for patients with irritable bowel syndrome to reduce their symptoms. Because when you look at the list, there's plenty of very healthy and delicious food in there that there's no good reason to avoid it if you don't have these symptoms.
Including gluten. So now we know.
Yes. So I think coming back to your original question is that perhaps some of the patients who are avoiding gluten were in fact inadvertently doing a bit of this low FODMAP.
I mean, if it makes sense. If you feel like taking a certain food creates that discomfort, then just avoid it.
Yeah.
So that's the most logical thing to do, I suppose.
So this low FODMAP diet is in use in Singapore for about the last 10 years. And we have studies based from SGH where I was previously from to show that for patients who are able to follow the diet, about 70% of the patients will benefit. But just be mindful that benefit doesn't mean complete elimination of diet. Usually we're aiming for about a 50% reduction.
Okay, so now let's maybe shift gears a little bit. Would you explain, the connection between gut health and other aspects of well-being like immunity, mental health? This time you mentioned something about brain gut, like there's a relation there, and even skin health. Yeah.
Yeah, so again, a very hot topic in the last 10, 20 years now.
Okay.
And there has been association shown between changes in the gut bacteria with many disorders, even outside the digestive tract. For example, anxiety, depression is one.
Wow.
Yes. As mentioned, skin disorder is another one. So there are studies to show that, in fact, there are differences in patients versus non-sufferers of the diseases in their gut bacteria. And it's a very interesting area. I think in reality, we are still learning. First of all, taking mood and gut bacteria to be an example, is that the communication is in fact two-directional.
Wow. Okay.
Yeah. So we now have this term called the brain-gut microbiome axis, meaning the brain is communicated with the gut, and the gut, of course, is communicated with the bacteria. And how the bacteria may affect the brain includes several things. First, their direct effect on the gut, they cause the nerve of the gut to feed back to the brain and change the brain's mood. Another thing is that they may produce inflammatory markers as well as hormones, which may then influence the mood.
I see.
Yeah. In my area of practice, we work closely with psychiatrists.
Okay.
Because of the brain-gut axis. So a lot of patients with irritable bowel syndrome do suffer from mood disorders, as I mentioned. And if that is the underlying problem, we do refer them to psychiatrists, particularly those who have a interest and focus in this area, and vice versa.
Okay.
A lot of patients with problems do experience gut symptoms. And so the psychiatrist may ask us to give them a hand and make sure that, it's nothing else apart from the mood.
This sounds like you look at the entire body as a whole system.
Yeah, and this is what fascinates me about the gut, because the gut is actually, you could call it a very sensitive organ. It gets affected by many things outside. So patients with diabetes, with hormone problems like thyroid disorders, may have tummy discomfort. I think, as you rightfully say, we have to be holistic and view the body as a whole, not as individual.
So the field of gastroenterology has seen significant advancements in recent years. Are there any emerging technologies or treatments that you find particularly exciting or promising in terms of improving, gut health or addressing digestive disorders?
So yes, this is where we look forward to the future. And hopefully one day we can give a very personalized therapy, meaning that we do look at the patient's individual characteristics to determine what kind of treatment may help them. So one example of this, for example, the use of probiotics.
Okay.
So as I mentioned to you, there are studies to say that probiotics may help certain patients. But if you think about this, how can one same type of probiotic help everyone in the world?
That's true.
What we've learned that actually is that you have to look more closely at the disease, the person, and the type of probiotics you're giving. Some probiotics have studies that are done on children, Asian population versus a Western population. So it's more important then for us to pick probiotic who has research done on a population and near to the patient that you're treating as possible. And in this way, we hope that the efficacy of the probiotic is more likely to be more successful. It's about us trying to figure out what is the best treatment for this individual.
Right. Personalized treatment.
Exactly. So we're still in the very early stages, but I think as we move on more, we will be able to do this much better. And hopefully with this, it means less side effect and better efficacy of the treatment we give. The area that I think it's been very interesting to a lot of people is known as fecal transplant. Fecal transplant is basically getting the stool of a healthy individual, processing it, and then delivering it to a patient. So this is actually an established treatment, although it sounds a bit yucky. So it's an established, in fact, very effective treatment for a very serious condition called Clostridium difficile. So this is a disease where a patient is infected with a very serious bacteria. Ironically, the person gets infected by this bacteria when too much antibiotic has been used. Then you get predisposed to this Clostridium difficile infection. And this fecal transplant therapy is in fact approved for this. And what is done is that we get the stool from a healthy person, we process it, and we then deliver it back into the gut of this person, which can be through the mouth, through tablet, can be using a scope. We'll put it down, or putting out the anus and then, putting it to the colon.
Okay, that is something that I have not heard of before, and I think it's very interesting to know that it's been around for a while.
It's been around for a while, and in fact, it is very, very effective for this particular therapy. So there has been hypothesis that it could be helpful for a whole range of diseases. Indeed, there has been study done on many other disorders, including inflammatory bowel disease and irritable bowel syndrome, where I'm interested in. This is an area of great interest. I think the research is still ongoing. But one might ask, if it's so good, why don't we just use it for everything? So
the psychological aspect of it we have to overcome first. But
yes, the yucky part of it you can overcome. But as a patient, you probably won't know if I don't tell you. We'll just say that we're putting a healthy person's gut bacteria into you. Without the stool part, might sound a lot more palatable. But so one other thing to caution is because actually when you put this gut bacteria population back in, you may be transferring a lot of the person's characteristics inside. While we do our best to screen out the most healthy person, you may not know what else he has that may then also be transferred into the patient who doesn't.
Personality, when you talk about characteristics, what are you referring to?
So one of the things that very interestingly has happened in the earlier days was we actually know that there is a difference in gut bacteria between a slim and a fat person. So one of the donors actually became fat when they received the stool from a person who was overweight. So the reality is that that's why there's a lot of caution. That's why we're not going out there and doing fecal transplant for every disease outside that. But what has been shown indeed is that how effective the treatment is depends on your donor. And so a lot of studies were effective. They realized that actually the patients who get treated all receive from what we call a super donor, meaning this very healthy and good person's bacteria is particularly effective. And in a group of patients, I'll say, 50 to 100 who get it, those who do best got it from this super donor. So I guess the key is, how do you find this super donor and make sure he keeps coming back and donating stool to your bank? And in line with this is the next targeted probiotic. Basically, what this is a engineered microbiome which is specifically designed to treat a certain disease. So the one that has been approved is again to treat Clostridium difficile. So patients with Clostridium difficile have very bad diarrhea, abdominal pain. Diarrhea is so bad they could have blood in it. They will have fever.
Very extreme.
Yes, they will be very sick, and it's life-threatening. So they have developed a spore of a certain bacteria that can be used to treat Clostridium difficile. So the good thing about this is it's very targeted. We're only dealing with one bacteria. In fact, we're just using the spore, which you can think about it like the egg of the bacteria. So it's more resistant. It doesn't get broken down by the body so easily. So the patient just takes this capsule. It goes in, populates the large intestine with this bacteria that can overcome the disease. I guess this is the next line of where we're going. One of the most important thing I've learned in my practice is to listen to what the patient really wants. Many patients simply want to know they don't have a dangerous disease. That's where I think we're great at doing.
Okay.
For some patients, they have a certain symptom that they want managed.
So in general, the advice that I think you will give to have a proactive approach is number one, to have a large variety of fruits and vegetables. I think that's the best. Avoid unnecessary antibiotics, right? And finally, most digestive diseases are functional in nature, but it's also important to exclude the serious ones like cancer or serious infection. And then if you still have your symptoms, to take it a step further, and people like, Dr. Wang is able to diagnose that further and to really look at what is the underlying cause of issues and to treat that, be it with a targeted approach, a personalized approach, so on and so forth. Yeah.
You summarized it perfectly.
Thank you so much. Yeah. So it's been great. And I'm so thankful that, that you've been sharing so much with us. I learned a lot. I hope you have too. So yeah, it's been wonderful. And let us know in the comments how you feel. Let us know if you have any questions, and we will put the contact and the information of Dr. Wang in our description. So if you have any questions, you can always reach out as well. Thank you very much. Thank you, Dr. Wang.
Thank you.
Thank you.